Okay, I think let's make a start then. So first of all, welcome everyone. Good afternoon, and thank you so much for joining us on this webinar today. If you have been attending our webinars this year, welcome to another one. I feel that we've done so many, but hopefully all of them have been really helpful for you. And if there's any suggestions of any more that you feel will be useful, please let us know that as well. We want to make sure we're supporting you as much as possible. So for those that I've not met yet, my name is Charmaine Jackson and I head up the training team for Ardens. And I'm also joined by my colleague Mariette Hadfield, who's going to be leading on most of this webinar today and is one of our training specialist leads. Now, this session is for EMIS practices only. So if you are a System 1 practice, unfortunately, this is not the one for you. We did do your webinar just yesterday, and what I'll do is I'll get the team to share the recording just in case you have joined the wrong one today. It may not make as much sense today. We're going to be showing both Ardens Clinical and Ardens Manager today. So if you are an Ardens Manager user, then great, we'll be able to show you what you can do with that. If not, we will give you details on how you can sign up at the end of this session. Now, in terms of housekeeping, same as what we would normally do, but for anyone that's new, you'll notice that your camera and your microphone is disabled, and that will remain that way all the way throughout the webinar. So if you do have any questions that you would like to answer us, then please use the Q&A option. So you'll find that in your normal Teams options at the top. Fire your questions away, and we do have colleagues who are ready and waiting to take your questions. So one of the colleagues would be Georgina Ford, who is one of our support team leads, and we've also got Chris Baskerville on the call today, who is our product manager for Ardens Manager. So it's really good to have him on board as well. So tell us your questions or answer us your questions and let us know your feedback. Session's been booked in for 1 hour. It will take that time and it will be recorded. So if you do want to watch back, you can. We will send out the recording to everyone that's registered on the webinar today. We will also make sure it's on our public website so that you can access it as many times as you like and also share it with your colleagues too. We are going to share a couple of poll questions and I'll do those in a minute. But before I do that, what we're going to be covering today is as follows. So first of all, Mariette's going to give you a good understanding of what continuity of care is. That's what we're going to be focusing on today, how we can support you in that area. Continuity of care is very much part of Network Contract DES. We're then going to look at the workflow to make it easier for you. We're going to then launch into a live demonstration. We're going to talk about next steps, and then we're going to talk about ongoing training and support. So hopefully that is helpful for you all. But like I mentioned, if there's anything else that you want to show you in the future, then please do let us know. So I'm going to do a couple of poll questions now, and if you just bear with me, it'd be good just to get a sense of where you are with continuity of care at the moment. So the first question I'm going to answer, it's going to pop up on the screen in a minute, is has your practice already implemented a continuity of care approach? So yes, no, maybe you're in progress in doing it, you've partially done it, or you're just not sure just yet, which is absolutely fine. So if you just answer one of those questions for me, that would be good. And then we can have a look at where you are. Perfect. So we've got 100 people exactly in the room today. We've got about 60 responses. So please do hit those answers so we can see where we are. And looking at that, Mariette, bit of a mix again, isn't it? It was the same as yesterday, really.
Yeah.
So quite a lot of you are in progress already, which is good. Yes, some of you have implemented it, and then we've got others that are not too sure, which is fine. And hopefully by the end, we will let you know exactly how we can support you with that. Okay, so next question then is, if you've said yes or partially, what are you using? Are you using the Ardens resources that we're going to show you today? Perhaps you've got your own local process. Are you using other digital tools? If you are, it'd be good to let us know in the Q&A exactly what that is. Or again, if you're not sure, you can just hit not applicable. So give us an answer on that one would be good. Ardens is winning. Which is good.
Yeah, quite a few people using it already.
Yeah, amazing. Quite a few of you not applicable at this stage. Hopefully that will change by the end of the webinar. Yeah, Ardens is very much winning, which is good. A few of you have local processes. Very little of you are using other digital tools. Please do let us know what those are, because it'd be good to get a good understanding of where we are too. And I think I'm just going to answer the question about Ardens Manager now, Mariette, before you launch in, so that it's a good idea to get a sense of who is currently using Ardens Manager. Now, remember, Ardens Manager is our population health management tool, and we're going to be showing you it today on how you can use it for continuity of care. I'm just going to share it. So do let us know whether you are an Ardens Manager customer. Maybe you're not. Maybe you're not sure. If you have an idea of that, that'd be good too. Wow, straight in with 80% of Ardens Manager customers. Very, very good.
A few people not using it.
Yeah. Cool. Excellent. I'm going to pass over to you, Mariette, then, and I'll come back on in a bit.
Lovely. Thank you, Charmaine. Right. So starting off then, what is continuity of care? So today is very much about the practical implementation of that. Most practices already know that continuity matters, but the real challenge is how you operationalize it in a busy system with lots of competing demands. We're not just looking at what continuity of care is today, we're focusing on how you actually embed it into that day-to-day workflow using all the tools available to you. So as Charmaine mentioned already, that does include Ardens Clinical, so your EMIS system, and it includes Ardens Manager as well, where you have got it available. So with your continuity of care, one of the most common misconceptions is that continuity of care is about prioritizing certain patients over others, but it's really not that at all. It is about prioritizing the continuity of that patient's care where it makes a meaningful difference. So we're not saying that one patient is more important than the other. We're saying that one patient is more likely to benefit from that relational continuity. So think about it in terms of it's not prioritizing patients, it's prioritizing continuity. Now, in reality, many patients are seen by multiple clinicians across the practice or PCNs, which can lead to fragmentation of their care. And what we're aiming to do is to introduce a structured way to help you manage that. Why does this matter? It matters because this isn't just a process exercise. It does have real impact. Practices that implement continuity well will often see better patient outcomes, and often that's in the form of reduced admissions, reduced duplication, and improved patient satisfaction. It also makes more efficient use of your appointments, and at the same time, that can help to improve your clinician satisfaction. We know why it matters, but why now? So just stepping back for a moment, continuity of care isn't just a quality improvement focus anymore. It is now part of the network DES, and it is a core contractual requirement. The latest specification makes it really clear that practices and PCNs are expected to identify patients who would most benefit from continuity and actively support that through how the care is delivered. And that is reflected across multiple areas of the DES, not just one particular place. It is important, though, that this isn't just about identifying those patients. It is about being able to demonstrate that the continuity is in place and it is being delivered in practice. And because of that, there is an increasing expectation that ICBs may ask you for that evidence of how that is being applied, not just in principle, but in reality. And that's where a really structured approach becomes really important. Using tools like Ardens, both within your clinical system and through Ardens Manager, gives you a practical way to put that in place. It supports you to identify those patients, apply a consistent model, measure your continuity, and crucially, evidence how it is being delivered across your population. So this becomes both a clinical priority, but also a contractual one. And this approach is designed to help you meet both of those aspects. Now, implementing continuity of care can be very challenging. In most practices, care is still largely delivered on a first available basis. That can work well for access, but it can certainly unintentionally fragment your care, especially for those patients who would benefit from seeing the same person over time. And the key point here is that not all patients are affected equally by that fragmentation. Most practices already try very hard to provide that continuity, but it is often quite informal. The challenge with that is that you don't have a consistent way to prioritize those patients. It can be really difficult to track that across a whole practice. And clinical systems alone don't give you that full picture. They're excellent at recording the information, but not measuring continuity at scale. And that's where your RAG model comes in. This gives the whole practice a simple, shared way to think about the continuity need. So rather than treating all your patients the same, we start to recognise where continuity really matters. Red patients are those with the highest continuity need, often with complex or unstable conditions where seeing the same clinician makes that significant difference to their health outcomes. Your amber patients would benefit from some consistency, but there is a little bit more flexibility in how that is delivered. And then you've got your green patients who can be managed a lot more flexibly where continuity is less critical. Key thing to remember here is that, again, this isn't about prioritizing patients, it's about prioritizing that continuity where it has the greatest impact. And for it to work, it needs to be applied consistently so that everyone in the practice is making the same decisions in the same way. Now, to make this practical, we're going to walk you through a simple 5-step journey, which is identify, record, navigate, analyze, and optimize. A key point to remember here is that for this whole journey, you do need both Ardens Clinical and Ardens Manager to complete it. Your clinical system is where the care is delivered, so that is where your RAG status is recorded and used. But if you want to understand how well your practice is delivering continuity overall, that's where the Ardens Manager comes in. You don't need it to get started with, but it becomes valuable as you scale your implementation journey. Clinical systems generally are essential. We need them for day-to-day running and recording notes in our patient record, but they do have limitations. What they can't do very easily is measure your continuity across the clinicians. They can't provide you with that consistent population view or even track your trends over time. And that's not a flaw, it's just how they were designed. So the most effective approach is to combine both of those systems together to create a sustainable model for you. But let's dive a little bit deeper into the model itself, starting with the identify stage. So here we start to identify the right patients. This isn't about doing everything at once. It's about starting with a cohort of patients. Now that might be your registers, or it might just be high frequent attenders, patients with multiple conditions, or even your frail patients. Whatever you decide to use to get started with, the Ardens resources can help you find these groups quickly. The key here is don't make it overly complex. It just needs to be consistent and usable. And we'll show you during the live demo how you can use both EMIS and Ardens Manager to identify those patients who need to be recorded. That takes us on to that recording step. So the next step is making the information visible and usable in your EMIS system. Because without that, continuity need is clearly recorded, it can't influence your decision making at the point of care. And again, with this one, we provide you with a template so you can consistently record that status and reports to help you identify which patients need a status recorded or who haven't had that done at all yet and how they move through the system. So again, we'll show you all of that in the live demo. That brings us on to the navigate stage, step 3, and this is arguably one of the most important steps here. So this is where your continuity becomes real in practice. Once you've identified continuity need, it should then start to actively influence how your patients are navigated through the system. Often that is supported with alerts and prompts, so you'll see those again in your EMIS system, but the key here is the decisions you make as a result of that. There's no point having an alert there if you're not going to act on that alert. So a helpful way to think about this is with a simple example. So imagine that you've got 3 patients on the same day with a very similar issue, for example, increasing fatigue and shortness of breath. On the surface, they look quite similar, but their continuity needs are very different. The first patient is living with severe frailty and multiple long-term conditions, so they would fall into that red category. They already have complex needs and multiple clinicians may be involved in their care. For this patient, the risk isn't just the current symptoms, it's the risk of fragmented decision making if they see someone new. So in this case, continuity is really important. Ideally, they should be routed back to their usual GP or usual clinician who knows them well. The second patient has a couple of long-term conditions and they may have recently had a significant diagnosis, so they sit in the amber group. Continuity is important here, but not quite as critical as that red group. So we might try to offer some consistency where it's possible, but there is a little bit more flexibility as needed. And then lastly, your third patient who has no significant long-term conditions and they don't meet any of the criteria for the higher risk groups. So they fall into that green group of patients. And for them, continuity is less critical. It would be safe and appropriate for them to be seen by any available clinician. So although these three patients present with very similar conditions and symptoms, the way they navigate them is different. Not because one problem is more urgent than the other, but again, because of that risk of fragmented care is different. And the key idea here, we're not prioritizing either one of those patients or their condition. We're simply prioritizing the continuity care around that patient. If we were to treat all patients the same and just book the first available appointment, we risk over-fragmenting that patient who can least afford it while using up the continuity where it's actually needed. Now, although these alerts are often focused around appointments and care navigation, they don't just influence your booking process. They can also support decision-making across your whole team. By making a patient's continuity needs visible in your clinical system at the point of care, your clinicians can immediately understand the context that they're working with. So if they're seeing a high continuity risk patient, so one of those red ones, they know that there's added value in maintaining that relationship. And it might be that it's arranging a follow-up themselves or avoiding that unnecessary handoffs and keeping the care more joined up. And for your wider team, it can just help reinforce that shared ownership because everyone can see which patients benefit most from consistency, not just the person booking the appointment. So the alerts isn't just a prompt, it's your signal to shape how you deliver care across your whole continuity of care pathway. Now, once your continuity need is defined, we move on to that analyze stage. And we need to know how this is being used in practice. So the next step is to step back and understand what is actually happening at population level. And this is where your analysis becomes really, really important. So using tools like Ardens Manager, we can start to look at the spread of patients across your red, amber and green groups, understand how those groups are changing over time. But beyond that, we can also start to measure how well continuity is actually being delivered. So some of the metrics you can use include continuity of care index and your usual care provider. All these things can help to understand things like, are the patients consistently seeing your same clinician, or are they seeing multiple different people over a period of time? We can then layer that over with the RAG model, for example, looking at whether our red patients who have the highest need are actually receiving that continuity in practice. And then we can apply that across different groups, such as your frequent attenders, frailty, or multimorbidities, to really understand where it's working well, but also where it's breaking down. So this stage is really important, asking ourselves, are we delivering continuity where it matters most? Because identifying the need is only part of the picture. We also need to understand whether the system is actually meeting that need. That then takes us nicely on to step 5, which is your optimize phase. Once we understand what is happening, the next step is optimization, which is about acting on that insight. So rather than just identifying the patterns, we start to make targeted changes. Now, this could be that we identify a group of red patients who are frequently attending, but seeing multiple different clinicians. That instantly tells us that continuity is breaking down in a group where it really matters. The response here might be to look at who those patients are seeing, whether they have a clear named GP, and how well we can adjust the booking process or follow-ups to just improve that consistency for them. So optimization is about making small practical changes in response to what your data is showing you, not just at patient level, but across your whole system setup. So just to recap, this is your implementation journey. Using your clinical system alone, so EMIS in this case, you can absolutely achieve the first 3 steps, but your Ardens manager will be able to help you complete that full journey in there. So with that, we're going to move into our live demos now to show you how all of this looks in practice. And I'm going to hand you over to Charmaine, who's going to do the EMIS demo for you.
Thank you, Mariette. We've had some really good questions as well, actually. A question that we get often asked is, what is the criteria behind red, amber and green? So we do have a support article which lists it out, but from the top of my head, red is like, is it severe frail patients? It's patients on the end of life register, and it's patients who have 5 or more conditions. Did I get that right?
Yes, that's absolutely right.
Cool, tick. And amber, we're looking at moderately frail patients who have conditions between like 2 to 4 conditions. And then green is like everyone else, isn't it? But
that's right.
If you look at the support article, it will list out what is in there in case you need to know that. We also have been asked if Ardens Manager, if there's a free version, we will let you know how you can sign up for a free 1-month trial at the end of this session. And question that you might want to expand on, Mariette, is if we want to use Bridges for Health or John Hopkins categories instead, can Ardens Manager help us with that? So do you want to answer that while I share my screen?
Yeah, sure. So that is a great question. And the answer there is yes, absolutely. So Ardens Manager provides a whole range of different risk stratification tools, including your Johns Hopkins and Bridges to Health. They're available right across the platform. And when we do the live demo for Ardens Manager, you'll see how easily you can switch between the different tools we've got available for you.
Amazing, thank you. So you should be able to see my EMIS screen now. So what I'm going to do is I'm going to walk you through the reports, the templates, the alerts that we have. And if you link it back to the implementation journey that Mariette just showed you, this part I'm showing you how to identify, how to record, and also how to be alerted as well. So I'm going to cover those 3 areas. Now, the EMIS system that you can see, this is a test environment I'm using. So all of the patients on screen, it won't be real patient information, but the way that I actually use the resources will be the exact same way you would use it in your system too. And everything that I'm showing you, you have right now. So if you haven't been using it, you can go away and you can start using it straight away. So I'm going to start with the identify stage. And this is where we help you identify who has a RAG status in their record and who hasn't, so you can prioritize those patients. So I'm going to go into population reporting, which is where you'll find all of the Ardens searches, like you know. And within population reporting, I'm then going to pick up the Ardens searches folder. Within the Ardens searches folder, I then want to focus on 1.37, administration risk strat. So that's where you'll find anything to do with continuity of care. If I expand that, I'll be able to see the folder. Now, we are currently on version 1.4, and I would imagine a lot of you will have 1.4 in your system. If you don't, you can download the latest version from the portal, and I'll get the team to share how you can do that. If you don't want to do that, then just simply wait, because we update you every 21 days. So therefore, you can wait for your next routine update, and you'll have the 1.4 version. So this is the version we're currently on at the moment. When you open up continuity of care, it's then broken down by 3 main folders: data quality, registers, and review. When it comes to anything with the identify stage, this is where we're focusing on the registers folder. So within the registers folder, you can see there that we've got a load of reports there. We've also got a search in there too. And that is broken down by what's already been recorded and what we predict should be the status. So if I start with recorded first, this is all of the patients that have had the RAG status recorded in their record. So you've decided that this patient needs to be segmented in the red category or the amber or the green, and you've put the appropriate codes in. It totals up those patients. And what you can do, so remember when it comes to running the reports, we just need to right click on the folder and select run. And once they've all been run, if I want to know details of who those patients are, so who are my complex need patients at the moment, I can highlight the report and then I can click on view results on the ribbon. And what that report will show me, remember this is not real patient information, it will show me who those patients are and the date that the code went in. So if you ever have to do any reviewing at any point, then this provides me with the information. That's the same for amber, that's also the same for green as well. Just below that, we then have recorded unknown. So these are all of the patients where we're not sure what their RAG status code is, so therefore they've got nothing recorded in their record. So if it comes to wanting to prioritise making sure that codes are in the records, you may want to start with this search here. So it's not a report, so therefore once you've run that search, to find out who those patients are, you need to go to population included, and that will tell you who your patients are. And from here, like you know, you can right click, you can go into their record, and I'm going to show you how you can use our template to add the relevant code. So hopefully that's making sense so far. Just above that is your predicted report. So this is where we're saying that patients meet the criteria for this RAG status, but they haven't got it coded in their record. So remember, going back to that criteria for our red patients, they're either severely frail, they're either on the end of life register, or they have more than 5 conditions. So what this report is doing is looking for all of those patients who meet that criteria, but they haven't got that RAG status in their record. We're suggesting that they should. So again, if you're looking at prioritization, these are the ones. So look at this one here where nothing's been recorded, and then you then may want to look at your predicted reports. Now, when it comes to adding this code, it is suggested that you have to go into each patient record and decide clinically whether or not that code needs to be going into their record. And again, you can hit the report and click on view results, and that will show me my list of patients. So this is everyone that should have a red code in their record. So when it comes to actually recording that status now, this is where we can help you with our template. So what I'm going to do is I'm going to switch to the consultation mode, and I'm going to actually go into a consultation. Move my screen a bit. There we go. And I'm going to hit on run template. And this is how you would normally search for an Ardens template. You may also use our launchers as well. When I click on run template, I'm going to show you what template you need to be using. Just bear with me while EMIS has a bit of a wobble. I'm sure it'll come back on in a minute. Perhaps just give us a thumbs up if all is making sense so far. So there we are. So we've hit run template now, and you can see at the very top, I've already searched for it. So the template that you want to be using is continuity of care template, making sure it's the Ardens one that you are picking up. Now, when you click on OK, and that template launches, at the very top, you've got the tick box here to say that you have done a proactive care review. So if you're checking to see what the patient criteria the patient meets, you can tick this box here. And then if they do already have a status in their record, it will tell you what that latest status is. So for this patient, it's green. And on the right-hand side, it tells me when that was entered. I've then got the option to either add or update. So if the patient's never had a code in their record, I can use this to add, or perhaps they were green, but now they need to be amber. I can use this template as well to update that accordingly. So I'll just tick the relevant box that the patient meets. Just below that, I've then got additional information I can complete. So it's telling me information around the patient's name, GP, if they have a carer, perhaps they're no longer a carer, if they have a care coordinator, if they have a social worker, I'll be able to see when that information was last coded. If I need to complete that information, I've got my drop-down fields or my tick boxes that I can select. Perhaps a social worker is now involved with this patient. I can tick the box and then I can type in the text field, and that will let my colleagues know that someone is dealing with this patient. I've also got the DNA CPR status, which will tell me whether the patient has one or not. And at the very bottom, if I want to add any key messages or special notes about this patient, I can tick the add a special note box, and in the text field, I can then type in what that is. Once I'm happy, I can save it, and now that status has been added to the patient. So that's how you add it, and that's how you update it going forward too. Now, Mariette mentioned alerts. So we have 2 alerts to help you with continuity of care. The most obvious one is the one that sits within the pink box. So now that the patient has that status in place, even if it's unknown, I think it will still show as well. If you are anywhere in a patient record and you look at that pink box there, it will let you know what the latest status is for that patient. So this patient is currently a green, they have a green RAG status, or it could be amber or it could be red. So this might be really helpful as well if you are booking, if you've got a receptionist who's booking an appointment for the patient, they want to see whether the patient is green, red or amber, they'll be able to see that information. Now it's important to note that this alert here, we don't switch it on by default. So this is optional, whether you want to have this on or not. I would suggest that you do, because it makes everyone aware of exactly what the status is. In a minute, I will show you how you can go into Resource Publisher and how you can turn that on if you feel it's going to be useful. The other alert that we have is to really prompt your clinicians to monitor that RAG status to make sure it's up to date. So anyone that's saving the consultation will get an alert in the middle of the screen to say, look, this is, well, it won't say look, but it will say, this is the patient's RAG status. Do you want to update it? So you've got the choice of two alerts. You can have both of them on, you can have either of them on, or you can just stick to your pink box one, which most people tend to, because it's then with your other alerts that we provide as part of Ardens. So if you want to switch either of these alerts on, I'm going to show you where to do that, and then I'm going to finish off with a couple of more reports, and then I'm going to pass you over to Mariette. So to switch these on, someone has to have Resource Publisher access, EMIS bubble, down to configuration, and then across to Resource Publisher. And please don't worry, because this is all in our support article as well. Once you're in Resource Publisher, hopefully it doesn't take me long. There we go. Once we're in Resource Publisher, make sure you're under Protocols and Templates. You want to move down to Shared Folders, because that's where you'll find everything that we have published for you. Within that folder, you then go to the Ardens Live National Content. And in Ardens Live National Content, you then go to Optional Protocols. And within Optional Protocols, you then go to Continuity of Care. So that was Shared Folders, Ardens Live National Content, Optional Protocols, and then Continuity of Care. The pink box alert that you can see on the right-hand side is this one here. So if you want to switch that one on, you'll know it's not switched on because it would be grey. So that means it's deactivated. If it's active, it would be in bold like my one is. If I want to turn that on, it's a right click, status, and then activate. And likewise for the save consultation. So it's just these two that you're interested in. That is the pink alert box. This one here is if you want the trigger to come on when they save or a clinician saves a consultation. And hopefully that makes sense. And we can repeat those steps at the end if you feel that's needed. And then lastly, before I pass you back to Mariette, I just want to go back to the reporting folder and let you know that we also have review reports as well. So these are quite useful to review on a regular basis because it's letting you know that these patients here, they've got a green status, but they've had 10 or more appointments in the last 12 months. Do we want to consider updating that status to maybe an amber or maybe a red? Or likewise, these patients are have a red status, but they've had less than 10 appointments in the last 12 months. Are they getting the right care that they need? So you may want to review these patients. Again, all reports, you can hit view results to see what the criteria is. And last, we have data quality. So we've got further predicted reports in there. And we're also letting you know where the patient's been recorded as amber, but they should be recorded as red. So they're predicted as red, or they're green, but they're predicted as amber. So again, it gets you thinking on whether or not these patients need to be clinically reviewed and their status updated. So hopefully that all makes sense. I'm going to pass you back to Mariette now for Ardens Manager, and we can always come back to this at the end if need to. So over to you, Mariette.
That's great. Thank you, Charmaine. Just before I move on to Ardens Manager, just highlighting a couple of the questions that have come in so far. There was one that said, how often would a RAG status need to be reviewed? Generally speaking, that recorded status would need to be reviewed regularly. Now, that is up to you as a practice what you consider regular. We've got reports available to highlight where there are times where you may want to review, but that is entirely down to you what you deem as regular enough. Some of the other ones that came in as well, there was a couple of people who mentioned they couldn't see the template. So again, that one, Charmaine, am I right in thinking that's the Resource Publisher? They can go and download it from there?
Yeah, Yeah, I would just go back into Resource Publisher. This is the template here, continuity. Oh no, I'm not showing my screen anymore, am I? I'm just talking to myself now. Am I showing my screen? There we go. There we go. Now I am.
Yeah.
So back into Resource Publisher, if you go to Continuity of Care template, this one here. So again, if it's grayed out, just make sure it's activated and that should be fine then.
That's great, thank you. And last one just to cover is somebody asked, do the codes get updated over time? So if someone becomes frail, do they move from amber to red? For the recorded status, that requires you to manually update that, but you've got our reports available to highlight for you where that might be the case. In terms of your predicted reports, they will predict where there's changes in the record, so those patients who move between will be included in your predicted reports and your data quality. So once we move on to Ardens Manager, I'll make sure to show you how you can see where those patients are moving. So let me share my screen with you all. Just to say, everything you see in this Ardens Manager system today is a demo environment, so there's no real patients or real practice names in here. For today's demonstration, we are just covering the continuity of care resources and the relevant features that go with that. It's not a general overview of Ardens Manager. So if you are new to the system and you don't quite know your way around, we'd recommend booking into one of our getting started sessions to get you going with that side. So straight into population side of things. So we're going to start off by looking at the identify stage. So that's those registers that Charmaine showed right at the beginning of the EMIS demonstration. To find this, we're going to go along the left-hand panel to your services menu and down to the population dashboard. Now on here, you've got a series of different tabs, and we're going to start off on the one labeled risk stratification. Now, just picking up on the other different types of tools we've got. So for those of you who mentioned Bridges to Health, Johns Hopkins, the risk stratification page here contains the registers for all of the patients and the various different tools. So on the screen now we can see there's Bridges to Health, we've got our continuity of care and Johns Hopkins. So there's lots and lots of different tools available for you to use, and you can mix and match and combine them all. But focusing just on our continuity of care today, I am going to filter my dashboard, so we'll remove all the other tools, just not to confuse them with anything else. So I'm going to click that filter button and I'm going to select continuity of care and apply. This will now show me just the relevant reports. Now, in terms of your registers, we've got the recorded status here and we've got our predicted model. So in the same way as your EMIS system, the recorded reports are purely just a patient who has that recorded code in their record, so you can see who has officially a recorded status. Whereas your predicted reports will be patients who were recorded and the ones who do not have a recording but are predicted to be in a specific group. Now we can look at this in more detail. So I can see under the count bit exactly how many patients fall into each one of these different cohorts. I'm going to start off with my predicted red, and I'm going to click on view to break that down. Now, the first thing here is understanding what is red or what is amber. So to help you with that, you'll see at the very end, you've got the rules tab. This one will show you exactly what the report is built on and any associated coding and criteria with it. So with our rules for this particular report, we can see that it's got 3 different rules. And the way that your predicted reports work is, first of all, it will look for a patient with a coded status of red. Where they haven't got a coded status, it then moves into the prediction model for rule 2 and 3. So rule number 2 is the prediction for the red category. And if we want to know what is considered red, we can click on the blue hyperlink and that will show you the criteria. So as we mentioned at the beginning, for red, it's severe frailty, end of life, and 5 or more long-term health conditions. Now you can drill into that a little bit further. So if we wanted to see what codes are associated with severe frailty and counted, click on the hyperlink again, and we can see that it's looking for the severe frailty code, any Rockwood scores, or Canadian Study of Health and Aging. And with any of these, you can follow these hyperlinks through to see exactly which coding is included. So for the Rockwood, these 4 codes are included. So it's really simple to navigate your way around. And then finally, you've got rule 3, where it will look at if a patient is coded as amber, but something in their records suggests that they've moved into the red category, that will also pick them up on here because it's a predictive model. So all of those different variances will be in there so that you can review your predicted lists regularly to see if any patients need to be recoded for those alerts to change in your clinical system. And on that point, just to say that for those alerts in the pink box, that does rely on a manual code being added. So if the status has changed for the patient, you would have to update it for it to be reflected in that pink box on there. Now, looking at the patients, clicking on your patient tab here, this will show you who those patients are for that category there. And from here, you've got a few different options that you can look at. First of all, if you wanted to use this list to code your patients, you can use the export function at the bottom here. This will extract the entire list and you can put it back into your clinical system. I must stress here, though, that we don't recommend bulk adding codes to patient records for this purpose because those codes should be added with clinical judgment. I know some practices do bulk code, and if you decide to do that, then obviously that's your prerogative, and it's just to show you that you can do that, but we definitely wouldn't recommend bulk adding RAG status codes because it does need to be clinically judged. So that's how you would do that to get that whole list of patients back into your clinical system. Some of the other things that you might want to do, though, is first of all, you may want to understand why is this patient in this report and what is it that they've been coded with? Are they coded with a RAG status or are they just predicted? And where do they sit in that? This check patient feature, the little question mark here, will give you all that information. Simply click on that one. It will take a couple of seconds to run the patient through the reporting logic, and you'll see it's grayed out while it does that. And then once it's complete, it will say included at the top, and then we can see exactly why. So first of all, we can see rule 1, the patient doesn't have a hard-coded RAG status. So we can move on to rule 2. So we can see that they are predicted as red because they're included in the red report. And when we move to rule 3, they're also included because they're not in the reports that indicate that they've moved between categories. So we know exactly where they fall in that grand scheme of things. So hopefully that will help you work out which ones are which. Now, the other thing you can do as well is working your way through the list to start coding your patients. You've got that view option. So with the view button, that single patient view. And what this screen does is it shows you every single report your patient is associated with on Ardens Manager. Now, how you can utilize this single patient view is, let's say we were reviewing this patient to be able to add a RAG status on. I want to see at the same time whether they have an allocated named GP. So I can click on my services menu here, and then I can search for named GP, and I can see here allocated named GP is on my to-do list. So this patient is considered red. They don't have an allocated named GP, so I can now quickly go and allocate them a GP and put a plan in place so that they have continuity. Now, directly from here, you can click the Open an EMIS button in the top right-hand corner, which will launch your patient record in EMIS, so you can start to add that coding and allocating that named GP. But remember, this patient screen here, patient view, is so helpful for lots of different things on Ardens Manager. And in a minute, you'll see just how you can use it to start to navigate all the different reports that the patient is associated with in terms of your continuity of care. So I'm just going to click the cross to come off of there. Final thing to mention on here is you've got all these tools available on the right-hand side, such as your demographics, giving you age groups, you've got conditions, looking at the different conditions these patients have, and also I mentioned about the risk tools being integrated into reports. So as you can see here on the risk tab, we already know we're looking only at red patients, but we can also see of those red patients, what are their bridges to health categories or Q admissions, Q risk, those sorts of things. Now, the reason I'm pointing that out is obviously at practice level for you guys, I'm sure that your lists of patients who require a RAG status isn't going to be as low as mine. So when you're looking at coding these patients, you may want to break that up into bite-sized chunks to be able to look at groups of patients rather than working your way through a list of thousands of patients. That's where these tabs along the right-hand side come in. So somebody mentioned about bridges to health and sort of cross-referencing things. You can absolutely do that. So if we said we want to code up our red patients here, but we want to start off looking at the frailty cohort for bridges to health, I can come to my filter, I can add that into my risk section. Let's pop that in there and click apply, and that will then shorten the list of patients down for me to only 72, making it just that little bit more manageable. And you don't have to use just the risk categories, you can use demographics, maybe focus on a specific age group or even conditions. So it's really flexible to help you break it down and start small, doing it bit by bit so it doesn't become this huge overwhelming task to do. So that's your identify stage. If you prefer working with slightly different reports, just to highlight that on the overview page of your population dashboard, right at the very bottom, you have a performance indicator for allocated named GP. So you may choose to start here as your starting point, and we can see here that for my full cohort of 4,000 patients, my registered list, just over 2,000 of them still need an allocated GP. I can click View. I've got access to my patient list here. And remember, because it is a performance indicator, you've got the option to show your remaining patients only, so that we're making sure we're only dealing with the right patients here. And then we can analyze the risk factor here. So we can say, okay, I can see I've got 107 patients who are classified as red, but they don't have a named GP. So using my filter, I can start with those patients. Again, pop it into the risk filter here. And I've now got access to just those 107 patients that I can work through and allocate a named GP. And at the same time, review that status, make sure that red is still appropriate for them, and get going that way. So that's your identify stage. We now move over into analyze and optimize. So for this bit, we're going to go onto the appointments dashboard, again from the services menu. Now, there's lots of ways in which you can analyse your appointments. So you can do it in the form of DNAs, you've got your high frequency attenders, there's so many different things. The one category just to point out is you'll see about halfway down, there's personalised care. And what these ones do is for the previous month, they show you for patients coded as amber, how many appointments were done. And again, the same for green and the same for red. So that can give you a quick view of what the spread of RAC status is compared to the appointments that you've done. So you can see what that level of demand is on your practice. Now, something that is useful is the continuity of care page in appointments. And this page will show you what your continuity looks like in practice across all those patients, not just for specific reports. So on here, you'll see that you've got the continuity of care index, and you've also got the usual provider of care model, which looks at the most frequent GP, but also the usual GP. And on here, again, you can see that you've got 0 to 20% continuity across GPs in the last 12 months, 20 to 40%, 60 to 80%. And what this does is it looks at all the consultations for that particular patient over the last 12 months and ascertain what the level of continuity was. So your 0 to 20% saw lots and lots of different patients, but they had no continuity there. Now you can delve into that in more detail. So we know what the numbers is, we've analysed it, now we need to optimise. So we can click on that view button. We can then have a look at the risk tab to see, okay, for my patients who have had very little continuity, what does the RAG spread look like? So I can see here that 80 patients who are coded as red are in this category, which is showing that clearly something is breaking down here. That patient is experiencing very little continuity. What I might want to do, first of all, is to look at the patient list. And again, I can open up that single patient view. And what I want to find out from here is, do they have an allocated named GP? So in your little search filter there, I can put in allocate. So for this patient, they've got an allocated named GP, because it's not on the to-do list here, but I haven't informed them who that allocated GP is. And again, for any of these patients, this list will show you whether that patient has an allocated GP or not. So that would be quite handy to kickstart that process of improving continuity for them. It may also be that you start reviewing their record to decide what can we do here to improve continuity for this patient. It might even be as simple as that they're predicted red, but they don't actually have a recorded status in the clinical record. So that would be your next step, is make sure that they have a recorded status so that they can be navigated properly. So just hopping back to continuity of care. So in the same way with your usual GP and your most frequent GP, you can then analyse that going forward. On the past appointments, just want to highlight your high frequency attenders. So that's a group of patients most practices like to begin with and want to analyse. So again, from a continuity of care perspective, if I was to look at my 20 plus appointments here, click on view, and again, head straight for the risk tab to see what patients are covered within here. So it might be that we look at our red patients here. I've only got 5. We take a look at the staff tab to see who are these patients seeing. Do they have a named GP? Are they seeing that named GP? And then also, what can we do about this? Is it usual for them to come quite this much, or is there anything we can do to improve continuity, which will ultimately drive down the number of attendances that these patients have? Just before we finish off, we've talked a lot about named GP and usual GP and everything, but also there is some value in using the RAG system for all of your teams across your practice. So a little example of how you can embed it into your general workflow for different kinds of roles. I'm just going to use the prescribing dashboard. So let's say you have a pharmacy team with 3 or 4 pharmacists and they're working their way through medication reviews that need to be completed. At the bottom of this dashboard, there is a performance indicator for medication reviews, polypharmacy, SMRs. And again, we can see that there's still over 1,000 patients outstanding who need those reviews. Now, rather than just clicking view and working through our patient list, booking in patients, what they can do to help improve that continuity aspect is to do that in line with the risk tab. And it might be that they choose to focus on the red patients first, because that's where your continuity matters most, and get those patients booked in with a named clinician who can look after them from start to finish and provide that continuity. And then once that's done, move on to your amber. And again, once that's done, move on to the green category, so that by the time you get to green, the capacity you have left can then go with any of your clinical pharmacists to complete that review. So that is how you can use Ardens Manager. The final point that I just want to say, because I did notice in the Q&A earlier that somebody mentioned about how do you evidence what you are doing. So a very, very simple way to do that is on your services dashboards, you'll notice there's a little plus yellow button in the top right-hand corner. You can use that function to record a review on here. Some simple little note in there to say, today we've reviewed our red category, put in some notes, and that essentially forms your evidence of what you're doing, and it keeps a login here for you. That all gets stored on this review tab here on any single page that you're clicked on, not just your risk stratification tab. So do make use of that one so that at a later date you can refer back to it. That brings us to the end of the Ardens Manager demo. So I'm just going to hop back to the presentation just to kind of summarize for us. So the key takeaways for today is to remember that continuity of care requires a structure. The RAG status aligns your care navigation to the continuity need, and that ultimately reducing the risk of poor health outcomes for your patients. Workforce optimization helps you to align your clinical time to patient needs. Your clinical systems deliver the care, and Ardens Manager enables that oversight for you. So thinking about where to begin, if you're still in that category of haven't started or partially getting going and you just need to know where do I start small. Pick a cohort, agree your definitions, and focus on consistency first. You don't need to implement everything at once. If you don't have Ardens Manager, it's absolutely possible to implement continuity of care without it. It's just that analysing and optimising becomes manual and scaling is that much harder. If you are not currently using Ardens Manager, we do offer a free trial for this one, which is a really useful way to explore your own data and start bringing this into a real life, real world setting. We do have our commercial manager in the call, just checking whether, James, whether you had anything to mention.
James is not on the call at the moment.
If James is here. If not, not a problem. So for anybody who does want to request a trial for Ardens Manager, just follow that link there, complete your details, and we can then send that off for you. To support you with getting started, so putting this into practice, we offer a range of training and support options, including practice training, webinars, and our wider community. But just to highlight a few key resources to get you started, we have detailed support articles that walk you through this model step by step, and that gives you something practical to refer back to after today. We also have a dedicated support team with an email address there that you can ask any questions and get direct support from the team. And finally, just really encourage you to have a look at the brand new risk stratification course on Ardens Academy. This course is designed to build that broader, deeper understanding of risk stratification in general, so not specific to just continuity, but how you can use that data proactively across your population. And it's a great next step if you want to take this further, or even just to help support the knowledge of your whole practice team. All of the Academy courses can be done in your own time, so it's really flexible to fit into busy practice schedules. And there's a lot more on there, not just risk stratification, lots of different courses. So whatever stage you're at, we have got you covered. Charmaine, I think there was one final poll question just before we move to feedback.
Yeah. So let me just launch that. I was just popping on the link to the Academy guide as well, so it's just quick for people to access. So yeah, it would be good to know now that you've seen everything, and when you go away, which Ardens resources are you most likely to use? So I'm just going to launch that poll question now. Go. Let us know. Will it be the reports in the clinical system, templates, dashboard? Maybe it's Ardens Academy. Maybe you didn't realise it was there.
For Academy. Yeah, for Academy there, which is great.
Yeah, I like seeing that, definitely.
Quite an even spread between the rest of the resources.
Yeah. We had a lot of interest about Ardens Manager in the Q&A, to be fair. So please do reach out to us if you want a demo, or if you want to sign up to that 1-month trial, then please make use of it. It's not just continuity of care. We have like over 20 dashboards, don't we, on Manager?
Yeah, we do. Yeah.
Contracts and service appointments. Like, it can help with everything. So, and we're doing a webinar on Thursday on Ardens Manager and how you can use it to manage your contracts, so QOF and network contract DES. So we can pop that in the Q&A if you want to sign up to that one too. Brilliant.
Fabulous.
Thank you.
So that brings us to the end of today's webinar. I hope you've all found it useful. As always, we do value your feedback, so if you can spare just a couple of minutes to share your thoughts, we would really appreciate that. But thank you all for being here today, and enjoy the rest of your day.
Thanks, everyone. See you on the next one.